Hi, my name's Sally Goodwin-Mills and I'm an advanced health improvement specialist specialising in infant feeding and maternity based in Public Health, Leeds City Council. The presentation I'm going to share with you today is on breastfeeding as a climate change imperative, to have a look at what difference breastfeeding actually makes. This presentation has been developed by the Breastfeeding and Climate Change subgroup of the Yorkshire and Humber National Infant Feeding Network. This group is a group of infant feeding leads who, as well as being passionate about breastfeeding, are also interested in climate emergency and how breastfeeding positively impacts this. Our objectives are to increase breastfeeding rates and to raise awareness and inform the public and local and national leaders about how breastfeeding positively impacts climate change. So to take a look at the context and why we're discussing breastfeeding as a climate change imperative, we have the long known and positive impact of breastfeeding on health and well-being, which we'll explore a little bit further later on in the presentation. We also have the Sustainable Development Goals, or Global Goals, which are a collection of 17 interlinked goals designed to be a blueprint to achieve a better and more sustainable future for all. These goals were set in 2015 by the United Nations General Assembly and are intended to be achieved by the year 2030. They are hugely ambitious, but appropriate to this presentation are thematic area 3 and 13. Number 3 is about good health and well-being, looking at the health benefits, the short and long term, especially of breastfeeding, are completely applicable to this presentation. And 13, climate action, looking at breast milk as a natural renewable food that is environmentally friendly, safe, produced without pollution, packaging or waste. And also looking at the alternatives, looking at formula milk production, and how currently that consumption generates greenhouse gas emissions, which can generate global warming. As I said previously, the Yorkshire and Humber Niffin Group, we're a small interest group looking at how we can raise awareness of breastfeeding and how it positively impacts climate change. We really want to spread the word about this and get more people involved. We've developed a small action plan which we look at regularly and update, and with each little action we feel like we're moving forward. Developing and presenting this presentation is one of our actions, and hopefully you'll be able to take this forward if you're interested and share with colleagues. We need help to gain support and momentum to drive the agendas forward together. An excellent quote there from J. Smith 2019 is around breastfeeding protection and how important it is. It says breastfeeding protection, support and promotion helps to safeguard planetary and human health by minimalising environmental harm. And I think that really encompasses the work that we're going to share with you this morning or this afternoon, whenever you're listening to it. Okay, so moving on to breast milk and breastfeeding. For many of you, you may very much be familiar with the benefits of breast milk and of breastfeeding. We have huge health benefits, but also many others that perhaps people aren't quite aware of. Every single mammalian milk is species specific and supports development of each different species. So human milk is specifically tailored for human babies. Human breast milk contains over 100 constituents that cannot be replicated in artificial formula. So it's completely different to a formula milk. Although each element has a specific role, many can impact in more than one area, and a combination can work together to affect something else entirely. So the breast milk itself acts at different stages, different times, and does different things depending on what the baby needs. Also, receiving breast milk via the breast, which might sound silly, but obviously can be given via a bottle instead, but receiving it via a breast is also important because the baby can influence the antibody protection via their saliva. So their saliva that's passed from the baby's mouth onto mother's nipple, which then sends signals to the mother's immune system to provide the antibodies that the baby needs to protect them from their immediate surroundings or within their immediate surroundings. New antibodies are produced whenever baby comes into contact with any harmful microbes, and mum can respond to that almost immediately. All of this works together to protect baby and the immature immunological system. So for baby, it reduces the risk of infection, allergies, sudden infant death, insulin-dependent diabetes and childhood leukemia. And they're really big, bold statements to make, but we have some really good, solid evidence that shows us there's a reduction in these things for baby if they are breastfed. And for at least 4 months, exclusive breastfeeding up to 6 months gives the exclusive breastfeeding for 6 months gives the maximum benefits, but ongoing breastfeeding continues to give baby the protection and the development and the nutrients that they need. In the mother, breastfeeding reduces the risk of breast cancer, ovarian cancer, and osteoporosis. It also assists with natural child spacing, which also plays a really important part of supporting the environment, because it can therefore assist with natural spacing and reducing the need for contraceptives and sanitary products, which are also an issue when we're looking at climate change. For both mum and baby, in the longer term, breastfeeding reduces the risk of cardiovascular disease and obesity. So you can see, if you think about all those illnesses put together, the reduction in the need for medical support, medications, can really again impact the environment. Importantly, breast milk and breastfeeding also supports baby's brain development, bonding attachment and responsive parenting. So it encompasses the whole picture and enables a good supportive network for baby. So we're also looking at breastfeeding in emergency situations. During emergencies, and this is really topical right now when we think of living during the COVID-19 pandemic where we are at the moment, the life-saving protection of breastfeeding is more important than ever, especially in those emergencies, those climate change emergencies, for example flooding and droughts and earthquakes where there is not clean water available to enable families to make up formula milk safely. Conflicts and natural disasters and epidemics often force families from their homes, resulting in devastating food insecurity, like I said, limited access to clean water and disruption to basic services, and often women and children are bearing the greatest consequences. In these settings, breastfeeding guarantees a safe, nutritious and accessible food source for infants and young children, and a protective shield against death and disease. Emergencies are stressful and can cause trauma for mothers, making appropriate infant feeding more challenging. But with adequate social, psychological and nutritional support, virtually all mothers can breastfeed, even in emergency situations. For some mothers, breastfeeding can even help to reduce stress. Okay, and we're also looking at where does infant formula come from, because it's really important to be aware and have some knowledge about this, and to recognise, as the group does, that formula milk has its place and is vital for some infants. When infant formula is needed, its manufacturer should leave the lowest possible environment footprint, and that's what we're lobbying for. One thing that we could all do is reduce the unnecessary use of follow-on toddler milks, and look at the advice and the information around recycling of formula milk tins and cartons, especially in hospitals, nurseries and other public and private premises. So, thinking about where formula milk actually comes from and the origin of it, we started to look at what is needed to make formula right from the beginning. So many people aren't aware that modern formula milk is usually made from cow's milk. It can be made from other animal milks, but most frequently it's cow milk. And that milk has been treated and things added in and taken out to make it suitable for babies to grow on. So basically formula milk enables babies to grow. Although it's a modified ingredient and a manufactured product, we know that it does come with huge environmental impact. It requires mass production by the dairy industry, with plastic and other waste and degradation of land and waterways. The volume of water it takes to develop and make up formula milk is huge, and we'll have a look at that footprint later on. Okay, so let's have a look at both sides of the story here, both sides of this picture that we've just been talking about. We've got a picture on the left of the breast milk cycle and a picture on the right of the formula milk cycle. And what it'd be nice to do would be to have a conversation with you, those of you that are listening to this now, but that's not possible. So I'm going to have a look at it and just talk you through what I see in these pictures, and hopefully that'll help and spark some thoughts for yourself and things that might be appropriate to you to take forward. So we'll start with the breast milk cycle and having a look at what's needed for breastfeeding in terms of energy and resources. So in this picture you'll see a lady breastfeeding and surrounded by people, because what's really important to recognise is that breastfeeding shouldn't be one woman's responsibility. It is a community responsibility. We need to ensure that women feel supported and able to get the support and help that they need to breastfeed. So that might be from family, it might be from friends, it might be community groups, it might be from your workplace, from different venues that you visit, from cafes to restaurants. We're looking at everybody just being breastfeeding friendly, and although we're talking about a lot of people here, you know, all we're asking is that people are supportive of breastfeeding, that if you see someone breastfeeding, you know, that we don't ask them to move. They are legally entitled to breastfeed their baby wherever they feel comfortable. So for breastfeeding, we know that the energy and resource comes from mum. Basically, mum, as long as she is able to and is well enough, she's able to breastfeed with the right support. And as we say, the majority of women can breastfeed with the right support. It's just currently, it's not necessarily seen as the norm. Therefore, it can be more. The challenges can rise and they can be a little bit more difficult because we don't always know where to get the help and support, even though it is readily available out there. Sometimes you need to seek it. So the formula milk cycle. So having a look at this picture, what we're doing is we're having a look from where the formula milk starts. You can see the cow in the bottom right hand corner of the picture. You can see the factory, you can see cars, you can see transport, you can see waste, factories. I'm looking at the picture now thinking, what can I see? There's so much going on there, you know, even from planting of the crops to feed the cows. But also looking at the other energy and resources used to make up a formula feed, thinking of the waste products especially, because even when we get right to that end product, it comes in a tin or a carton or a bottle, a glass bottle sometimes. We don't know, are they recyclable? Are they plastics? What are the tops made of? The scoops that are inside the tins, the foil covers, for example. You know, and that's just one element of this whole formula milk cycle. To make up formula milk, there's an awful lot of boiling of water needed, and often that's done many times a day due to the safety instructions of making up one feed at a time. We need water to wash the equipment, detergent to wash the equipment also, sterilising fluid, steaming, microwaving, refrigeration of that milk if people are storing it, heating up of milk, throwing away milk that's not used. There's an awful lot of waste that can come along using formula milk. And as I said previously, this group absolutely recognises that in some instances formula milk is absolutely necessary and some women choose to use it. But what we're looking at is lobbying for that footprint to be as green as possible. Okay, so this poster brings together a lot of what we've just talked about really beautifully, and it's been designed and developed in Barnsley. So having a look at it, and when I talk through it, have a think about, did you know about this before you heard it today? Can you think of any other ways that breastfeeding helps the environment? And are there any negatives for the environment caused by breastfeeding? It'd be really fantastic to have some feedback, and we'll give you the way to do that at the end of this session, to hear about what you think and whether or not you have any answers to these questions that we've posed. So breastfeeding helps the environment through reducing methane gas emitted by cows, electricity reduction as no boiling kettles or steam sterilisers required. It's available at the right temperature and saves on water. It's a sustainable product. The transportation pollution is eliminated and it's free to families, so no strain on family budgets, especially for those struggling in this most difficult time. It's environmentally friendly. I think we've made our case for that. There's no waste going to landfill. It excludes the pollution caused through manufacturing and doesn't require the use of plastics, teats, bottles and sterilisers. We see improved health outcomes for future generations, and we have really solid evidence that shows us that. And when we think about the health slide that we looked at previously, you see all the health benefits and the reduction in risks for babies, children and families. There's no processing at all required. It is simply made by mum. And it's good for everyone. The benefits of breastfeeding are not just for that individual mum and baby. The outcomes are for everybody. Okay, so we have a couple of quiz questions for you. And obviously, if we were doing this live, we'd be able to do it as a poll and we'd be able to talk through it a little bit more. But I think it's really useful and really interesting to have a look at the difference breastfeeding can make. So let's start with the first question. For the UK alone, carbon emission savings gained by supporting mothers to breastfeed would equate to taking how many cars off the road each year? So I'll give you a moment to think about that and to think about what impact that might have. I've got over 500, over 5,000 and over 50,000. I wonder what you're thinking. The answer is actually over 50,000, which is a huge amount of cars being taken off the road each year, and we know and recognise the impact that driving cars on our roads has. Okay, so the food industry, particularly dairy and meat production, contributes to around what percentage of global greenhouse gases? So here we're thinking of the dairy and meat production. How much percent of global greenhouse gases? Is it A, 25%, B, 30%, or C, 40%? All of those numbers are huge actually, aren't they? But the actual answer to that is 40%. So well done if you got any of those right. We've got a couple more coming up. Okay, so powdered infant formula can be made safely only with water that has been heated to at least 70 degrees centigrade, the energy use of which equates to charging how many smartphones per year? Again, huge numbers here. 200 million, 5 million, or 45 million. And you think how many of us charge maybe more than one phone in our houses. In fact, many of us charge, 2, 3, 4, depending on how many are living in your house, overnight, each night, or during the day. How many do you think equates to? Okay, answer is A, 200 million. It's almost very difficult to imagine what that looks like, isn't it? But 200 million smartphones. So that is just making up of the infant formula, not any other part of the process of making it, sorry. And finally, how many infant formula cans are disposed of every year? Would it be 500,000, 100,000, or 550,000? Okay, so if you've guessed C, 550,000, you're absolutely right. It's an awful lot, again, when actually many of them are not recyclable currently at the moment. And again, that's something we're lobbying for, to make things more recyclable, so that at least where infant formula is necessary, we can make sure it's as green as possible. Okay, so this next slide gives you the opportunity to have a think about what the barriers are, perhaps, and the determinants of breastfeeding. So we know that approximately 70% of the population start breastfeeding, but once it gets past 2 weeks, 6 to 8 weeks, we see the numbers of breastfeeding families reducing. So what are those barriers and what are the determinants of breastfeeding? So that's something that I'd like you to have a think about as you're watching this short film. I hope you found that interesting. I think it is really powerful just to explain and give a little bit of context when it comes to thinking about the barriers to breastfeeding and why perhaps some women choose not to breastfeed, and how challenging it can be for some women and some families. Okay, so what's already happening around this topic area of breastfeeding and infant feeding and climate change? So, looking at our local picture, we are the first breastfeeding and climate change subgroup and the first group to be looking at this, pulling the two topic areas together and trying to develop something of an action plan. Our first step was looking at how we can get this message out to more people. And by doing this presentation, we really hope that that will be the case. We're hoping to share it live in many areas during Earth Day week. So Earth Day is the 22nd of April, and for the beginning of that week, the 20th to the 22nd, there's lots of different activities and things going on that week. So we're hoping to share this live in many areas, but also to record it so that we can have it and share it far and wide. Just again to give people more information and hopefully raise some awareness and interest in this topic area. Locally, we're each looking at recycling of products in our healthcare trusts and local authorities, looking at how we do this and what departments perhaps are responsible for it and how we can perhaps improve it. And also looking at ways we can lobby, working with the West Yorkshire and Harrogate Health and Care Partnership Climate Change team, looking at working with different areas, different people, different groups, at how we can approach people, perhaps again in different ways that we haven't managed to do before, to raise awareness and interest of the topic area. And looking at the national picture, there's not an awful lot out there. Well, there's nothing out there that we have found as yet. We might be wrong. And again, by sharing this, we're hoping that people might come forward and say, actually, we know different things are happening. But at the moment, we're not aware of any other group or any other area sharing this sort of information and trying to pull the two areas together. So again, be really interested to hear more about what other people might be thinking and doing in different areas. So this slide just really highlights the cost implications to perhaps not breastfeeding and to using more of the infant formula, as is the case globally. Some of the key findings really reflect what we were talking about right at the beginning of the presentation around the health and well-being benefits of breastfeeding. According to this document here, the World Health Organization recommendations to increase breastfeeding rates have the potential to prevent 700,000 child and maternal deaths, saving billions of dollars, preventing hundreds of thousands of cases of childhood obesity, and saving families huge percentages of their household wages by not having to purchase infant formula. One of the most stark statements that I have seen that really outlines this in economic terms is from the Vice President of the World Bank in 2015, who declared that in sheer raw bottom line economic terms, breastfeeding may be the single best investment a country can make. And I think that is a really hugely powerful statement, and I think absolutely in economic terms, but what we're also really hugely aware of is in terms of the climate change emergency. Okay, so moving on to what next. Okay, we've shared this information, and that was a key action from our action plan, to share this presentation widely, to raise awareness locally, regionally and nationally, to really get this information out there and to make people more aware, to make people ask questions. We'd really want people to come forward, ask questions, find out a little bit more about this, for us to learn more as a group as well and to link in with the right people. We've developed it now as a webinar. in this format to enable easy sharing. So if you've enjoyed this, you think that you know someone who would like to hear it, please do pass the link on to them and encourage them to have a listen, and again to get in touch with our group. We want to collaborate with partners and build new relationships to link these agendas up. We would really like to see a wider audience to the Yorkshire and Humber Breastfeeding and Climate Change group. It'd be really great, fantastic to have more people interested in this and more people on board to support this work, hopefully to see it develop and grow. And also, we really want to implement the action plan that we're pulling together and work with those partners to develop new actions. So after you've seen this presentation now and you've heard this information, what next? What do you want to do? Will you make a pledge? Will you say what you might do next? Will you say what you could do to help? Will you share this with a friend, a colleague, a partner, to share the messages far and wide? It'd be really great if you are interested, if you want to get in touch with us, if you use my email address to get back to us and to share with us perhaps what you would like to do and how you would like to become involved. I'd just like to say thank you for listening. Thank you for being interested enough to sit and listen to the webinar. If you've got any questions that you'd like to raise, please do so on the email provided, and we'll get back to you as soon as we can. Right at the end of the presentation, you'll find on the next slide some references to some papers and articles that you may find interesting. And again, if you want any of the, if there's references that you want that you don't think that you find in here, do get in touch and we'll let you have some further information. Thank you once again. Goodbye.